So thanks for joining us tonight. My name is Clint Worth. I'm the regional representative for health and safety in the Prairie region. And we'll have about a 45-minute hour discussion, depending on how wordy I am, looking at the concept of office safety and how it's a health and safety issue. So what we've tried to do is create some material that's relevant to those that are affected by a return to work policy or return to workplace policy and the application that the employers have with that. But we also wanted to look at it from the perspective of those that never left the workplace, looking at it from more specifically the health and safety issues related to the change in work, those sorts of things. We'll look a little bit at the duty to accommodate and how all that plays in. So, like I said, we'll have about a probably about a 45-minute discussion, and then we'll open up the conversation a little bit, have some Q&A for questions. I'll leave you with some resources to continue the discussion. So, my work location is on Treaty 1 territory and the national homeland of the Red River Métis. We acknowledge the ancestral lands of the Anishinaabe and Ninisinanu, Naheithawak, Dakota Oyate, and Métis peoples. This territory is also the place of significance for the Desulene and Inuit, some who have been living here for generations. Serving as stewards since time immemorial, elders and First Nations have highlighted that these ancestral lands remain unceded and that the treaties are agreements to share, not to surrender the land. Remembering the original spirit and intent of these treaties can serve as a foundation to better our relationships. Through the land, we recognize our connection and commitment to working with the Red River Métis, all First Nations people across Turtle Island, and the Inuit of Canada. As a union, we have a responsibility to build and nurture relationships with First Nations, Métis, Inuit, and strive to respect, value, and incorporate Indigenous knowledges and perspectives in the work we do and in our own governance. As individuals, we have a responsibility to listen, learn, and grow on our paths towards truth and reconciliation. If you've attended a webinar or an education session or a Zoom meeting with me before, one of the things I've tried to practice is something that I learned from an elder. And basically, what they said was, if you want to go beyond just reading a statement and moving on with the regularly scheduled program sort of thing, what they suggested was every time you have to deliver a land acknowledgement, uh, come prepared to share something, one new thing that you've learned in your road to truth and reconciliation. So for me, reflecting back on that question for this event, um, I was honored for the opportunity to attend an Indigenous Health and Healing gathering that was held in Winnipeg a little while ago. And one of the key things that struck me about that learning opportunity was one of the keynote speakers, who is Phyllis Wallstead. If you don't know who Phyllis Wallstead is, she's the originator of the Orange Shirt days, where in 1973 she showed up to the residential school wearing a bright orange shirt that she was proud to wear, and they took it away from her, never to be seen again. And she talked a lot about the impacts of that as a young child, and she talked a lot about learning from those experiences and using them to share and educate and let and give people an understanding of what happened around the residential school system, that sort of thing. The importance of September 13th, because that was the day that Indigenous children were rounded up and taken to the residential school programs, those sorts of things. So Orange Shirt Days kind of morphed into Truth and Reconciliation Day, recognized on September 30th. So I really found that valuable in my own learning experience, attaching some personal stories, sharing those sorts of uh, events that help me grow in my own experience. So I encourage you, especially if you're on a local executive or you're on a committee, those sorts of things, and you have to deliver an Indigenous acknowledgement, you take the time to learn a little bit more about the land on which you live, the impacts of the people that live on that unceded territory, and steps that you can take in your own path to reconciliation. So as I mentioned, we've got a pretty short program. Like I said, probably about a 45-minute presentation. We'll open up some Q&A. Generally, what we'll talk about in the course of this evening is, first of all, I'll introduce Marianne shortly. I have two rules for Marianne, and she knows them very well. First one is she gets as much time as she wants for opening remarks, and she always gets the last word for our webinars and our sessions such as this. Uh, so what we'll do is we'll look specifically at the return to work policies and how it's a health and safety issue, how we can look at um, the issue of how people are returning to the office, some of the challenges with returning to the office, how we can look at it, as we have been from a bargaining issue, for a lot of our bargaining units that are working to improve the language around the return to office policy. Um, which is really great work, but I think it's also helpful to look at it specifically from a health and safety issue. And what we'll do is we'll talk a little about the role of the workplace committees or the health and safety representatives on how we can use those mechanisms to make improvements and changes to our work-life balance, to our work lives for the benefit of all. Well, what I'll do is have a bit of a checklist that we'll use. And what it will do is we'll talk about a number of different things to consider in a return to workplace. Some things might be obvious. Some things might be a really good reminder as to things that the employer ought to be doing when they look at people in the office, those sorts of things. And then lastly, we'll look a little bit at where do we go from here. I'll leave you with some tools, resources, tips on how to move forward with bettering the workplaces for those that are returning to work or never left the office. So with that, I'll turn it over to Marianne Ledoux, who's our Regional Executive Vice President in the Prairie Region. So Marianne, I'll open it up to you and your cat.
Yeah, sorry. I just got
No.
home, so the cat is like trying to say hello, so you'll see a tail go by. So welcome, Butterbean. Thanks everyone for joining. For those that were doing remote work, I know the office mandates is a priority to get fixed. So we are working at the bargaining tables on the issue. We filed every legal challenge, everything we can do. But the one thing, and this is why we really wanted to do this webinar, when it comes to health and safety, our health and safety reps in our committees, when you're sitting across the table from the employer, you are an equal. And so there's a lot of things that you can do, and the legislation gives us a lot of rights. And if we're not using those, it's missed opportunities. And this is a good way to get our message across to the employer that their plan for return to office is not going to work. Some buildings, probably not an issue, but it is. Some of these things are issues everywhere. It's good information for return to office, but this is good information, period, for all workplaces. And, like I said, when it comes down to it, you are an equal when you sit across from the employer. And if they say no, 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 then, you're at the local level, then start sending it up to the national, right? We have to start pushing back on some of these things. And this is something that we have the full authority to do so. I want to thank Clint for pulling this together. We did get some resources from national, but Clint put it together in a presentation, and we wanted to be able to not just send out some sheets. We wanted to be able to kind of explain some of the stuff and give folks an opportunity for some questions. So thanks for all the work you've put into it so far and what's going to come out of this. And I will let Clint do his presentation. I may go have supper. I just got home, but I will be listening and I will be here for questions.
Okay, yeah, thanks, Marianne. Yeah, it was kind of funny. The national office reached out to me, said they wanted this initiative, and they rolled it in with some of the Treasury Board bargaining updates. And they asked me, what to do, and I said, well, I've done a similar presentation a couple of years ago, so I shared it with them, and that's what they used for the Treasury Board. So I I didn't get it from them; they got it from me. Uh, so, so as Marianne kind of said, this is not a new conversation. It's certainly things we've been working at. um, in a number of different avenues. So definitely an issue that we can use all the tools in our toolbox to make improvements uh, to our working lives. So when Treasury Board and agencies did, first rolled out the return to office, probably a couple of years ago now, and introduced the concept of going back to work like 3 days a week, sort of thing. PSAC did a survey, and we got some really strong results from that that are really worth reviewing in this discussion today. So out of the 65,000 people that responded, 91% were strongly opposed to the new telework mandate. 64% of the respondents were likely or very likely to file a grievance. That's how strongly they felt about this issue. And 75% of respondents were willing to take action to fight the new telework mandate. So really strong opinions on this, and a number of reasons for that that we'll kind of explore a little bit. So when we look at some of the key issues that were brought forward during that survey, there was a number of things that people highlighted as areas of concern. The highest ranking one was the expenses, parking, childcare, lunch, commuting, you know, buying clothes, those sorts of things. All those expenses with physically reporting to work were high on the list. And kind of tied in with that was commute time and transportation. Work-life balance was right up there as well. Environmental impacts, mental health, caregiving responsibilities, those sorts of things. And also was highlighted and is reinforced in some of the discussions I've been having with places is the concern with a lack of workspace. You have more people than ever trying to report to work when there isn't enough workspace for all of them. So even 2 years ago, that was highlighted as a concern, and it's certainly come to fruition in a lot of our workplaces when we've looked at the concept of returning to office and having more and more people in the office at the same time, as well as job satisfaction. So even within that list of issues, there's a number that would fit in with what I would define as under the umbrella of health and safety. So when we look at things like work-life balance, the environmental impacts, mental health, lack of workspace, uh, job satisfaction, and the general concept of well-being, all of that tied into that fits under the umbrella of health and safety. So it helps when we look at this issue from the perspective of health and safety. So one of the things I always like to do when we look at this and kind of further explain why we look at it from a health and safety perspective, when we look at the concept of health and safety, we're not looking just at what we typically define as physical health and safety. When we look at the definition of health and safety under the World Health Organization, it's defined as a general sense of well-being. So anytime we want to look at health and safety, we want to look at not just from the physical trip and fall aspects of health and safety, chemical exposures, all that sort of stuff. We also want to look at it from the concept of well-being. One of the key issues that we've seen throughout in the challenges of return to office, people returning to office, return to office in full strength sort of stuff, is the concept where the employer wants to unlearn everything that we learned over the pandemic and over the last 6 years. They want to go. One thing that we learned over the pandemic is that our definition of work has changed over the past 6 years. The definition of what we define as workplace has changed over the last 6 years. How we connect with coworkers, how we communicate, the tools that we use to communicate has changed dramatically over the past 6 years. The employer wants to basically, I feel like they want to ignore that and not use the tools that we've become accustomed to using, such as Zoom, such as Teams, such as OneDrives and shared documents, all that sort of stuff. That is so much more become the norm, more the norm than it was, for example, 6 years ago. One of the things the challenges that people always have when there's a strict mandate coming down from the employer, top-down direction sort of stuff, is They're also ignoring the concept that um, things were demonstrated to be working and working well when people were working at home. There was less sick leave used, like much less sick leave used. People felt more fulfilled in their work. They felt there was a better work-life balance. Um, they were more productive, those sorts of things. All of that was demonstrated to be working and working well when people had the opportunity to work from home. Then it raises the obvious question, what's the rationale? What's the driver for the employer with these heavy-handed policies and directions, for working from home when we've demonstrated that we can work well from home? And there's a number of issues, why that is that we won't go, down that road too much. Uh, but it's certainly a difference of opinion from the employer's initiatives and agendas and what's best for the employees. When we look at health and safety, it comes from an area of flexibility and respect. Those are some of the cornerstones when we look at a healthy workplace. Those are some of the things that we see happening in workplaces. When we see things like top-down direction, inflexibility, lack of consultation and participation, and top-down direction sort of stuff, that's when we see pushback, we see challenges, those sorts of things. We see the grievances, all that sort of stuff. And when we look at the concept of health and safety, we really want to tie into the concept of well-being and looking more specifically at the CSA standard, where it looks at initiatives and things that employers and workplaces can do to create a healthy workplace. So it could be opportunity for advancement. It could be reward and recognition. It could be flexibility in work. It could be that they have the opportunity to participate and are consulted, that their opinion matter. All of those sorts of things are built into the concept of well-being and health and safety that aren't being fully utilized and recognized when we look at the concept of returning to the office and increased numbers returning to the office. We also want to look at this from a health and safety perspective because there's lots of really good supporting language around this issue in health and safety in the legislation, whether you're under provincial legislation or whether you're under federal legislation. That's on top of what's already enshrined in many of our collective agreements and direction that are already there. And we'll talk a little bit about, when they're not respected by the employer, some of the challenges that creates. We'll also have a build into our brief discussion in the short time that we have together, the concept of duty to accommodate and how that cannot be ignored when we look at the issue of returning to the workplace. Duty to accommodate, it falls under the purview of the human rights legislation. And if you've heard me talk before, that is the top echelon guidance and language and legislation that we need to follow. Nothing in any collective agreement, in the Canada Labor Code, in the regulations, collective agreements, employer policies, or procedures can take away with what's enshrined in the Human Rights Act under the duty to accommodate. So I've done lots of training on accommodation. I'm not going to go into it too much, but absolutely something that we'll discuss as we go through the evening. We won't spend too much time looking at the actual legislation, but there is a couple sections that I do want to highlight that are really important to set the table for our conversation this evening. So the first one is under the Canada Labor Code, Section 124. Every employer shall ensure that the health and safety at work of every person employed by the employer is protected. That's what I like to call the umbrella type language. That's the language that provides a general statement. Really important to highlight that when the very next section in the Canada Labor Code says, without restricting the generality of Section 124. So nothing takes away from that general statement. Everything either clarifies, builds off of, expands on. Nothing takes away from that statement. Nothing takes away from the employer's responsibility to ensure that every person is protected. That's not just the majority of people. Doesn't give the opportunity for employers to ignore those people that have the duty to accommodate or family status needs, those sorts of things. It's each and every person employed by that employer. Then that section 125(1) goes on to kind of clarify key concept there is, and we'll talk a little bit as we go through some slides, is to the extent the employer controls the activity. So some of the discussion, that we'll have this evening, the question might be, um, where does the employer, control the activity, especially when we look at, entry and egress from office buildings, downtown safety, those sorts of things. When we look at our provincially legislated members, so our academic sector in Alberta, University of Saskatchewan, um, the Casino Regina, University of Winnipeg, NETS here in Winnipeg. They fall under provincial legislation. And there's very similar, almost identical language in Section 12 of the Saskatchewan provincial legislation, Section 4.1 of the Manitoba legislation. Alberta, as you can imagine, not the greatest language for health and safety, but that the concepts that we're talking about in the Canada Labor Code are enshrined throughout the Alberta legislation, even if it doesn't specifically reference that in a standalone section, like it does under the Canada Labor Code or the provincial acts. The other key section that we want to really highlight in our conversation is this one. And this one has to do with the role of the committees, the role of the representatives, those sorts of things. So this language that we see under the Canada Labor Code refers specifically to the committees. Very similar language to our smaller workplaces that have health and safety representatives. And there's the sections that deal specifically with policy committees. The key thing to highlight is this wording. Shall participate in the development, implementation, and monitoring of a program for the prevention of hazards in the workplace that also provides for the education of employees in health and safety matters related to those hazards. And then along with that, shall participate in the implementation of changes that might affect occupational health and safety, including work processes and procedures, and where there is no policy committee, the workplace committee or health and safety representative shall participate in the planning and implementation of those changes. And that's a key aspect that Marianne was referring to in her opening comments that we'll build off in our discussion. There's an obligation for the employer to consult and have the committee participate in the implementations that might affect health and safety. As we've already established in our conversations this evening, there's a number of aspects with the return to office policies, the mandates that have been coming forward, where that legitimately affects health and safety. That then is the trigger for the committee to be involved in those discussions, participate in the implementation, be consulted in their creation, and participate in the planning if there's no policy committee. That's one aspect that we've clearly seen not many workplaces are utilizing. It's a top-down direction, no consultation with the committees, even though it clearly affects health and safety, no consultation with policy committees, no consultation with the affected unions, those sorts of things. And again, when you see that top-down direction without any consultation, participation, input, then you're going to see the challenges, and rightly so. And similar to what we looked at with the Canada Labor Code language, there's very similar language in the provincial legislations for our provincially legislated members. So what I want to do is use this as a bit of a checklist. So what I want to do is look at some of the issues that may impact health and safety, especially when we look at the return to office, return to buildings, those sorts of things. So here's a pretty good list of some things that I think are really important that employers, workplaces, workplace committees, health and safety representatives, policy committees, and local executives need to ensure the employer is considering in the application of how people are safely reporting and returning to work. So the first point around safe entry and egress to buildings. So when we look at the concept of to the extent the employer controls the activity, This is one of the questions I often get around um, where does the employer's responsibility start and where does it end? The employer has a responsibility for safe entry and egress from the building. So if you have to walk on a public sidewalk in order to get into a building, that becomes the employer's responsibility, even if it's public sidewalk. Another example I'll use is if the employer has indicated that you must park in this location separate from your office location. If you use fleet vehicles and they're in another location, that area between the workplace and the parking location is considered the workplace. And when we look at this from a health and safety perspective, it also looks at we also need to adjust the concept of working safely in your own home setting if you have the ability to work from home. One of the things that we often see increasingly in our society is challenges to safely, especially in downtown work locations. One of the things that I've personally noticed, over the course of the past number of years, um, is the increased safety concerns with reporting to work in downtown locations, where a number of our office, buildings are. The employer is going to say that that's not their responsibility, when absolutely I believe it is. They chose where the offices will be. They chose who's reporting to those offices. It needs to be a consideration how to report to work safely. They can't, I don't believe that they can wash away the concerns with society and downtown safety when they're dictating where people are working. We also want to make sure that we're aware of safe occupancy rates. We're meeting the code for physical space, those sorts of things. There's some really good guidance in for our federally regulated members and in the Canadian Occupational Health and Safety regulations. There's also some corresponding language for our provincially legislated members around the concept of safe occupancy rates, how many people should be in a work location, space between offices, space in doorways, in hallways, all that sort of stuff that really needs to be considered, reevaluated when we're looking at the physical space in the workplace and more people being in there at the same time. We also need to make sure that there's the adequate number of first aid attendants. So depending on your legislation, there's a requirement for first aid attendants to be in the office at all times that the office is open and people are working. Who those attendants are, how often they are there, is there coverage if they're away, vacation, those sorts of things. Depending on the size of the workplace and the number of employees reporting there, that determines how many first aid attendants there are. Absolutely consideration for the committee to be involved in those discussions to ensure how many first aid attendants are there. One of the ones that was mentioned, brought forward by a workplace was around the amount of washroom facilities. So they've got more and more people reporting to an office, but the washrooms and the number of facilities, the availability, the proximity, all that sort of stuff isn't up to the standards as outlined in the regulations. So we want to ensure that there's adequate amount of washroom facilities in every office setting, in every workplace that people are reporting to. Those numbers might change depending on the number of people that are required to report to that office. One of the issues that has been highlighted for a long time, especially in a lot of our federally regulated workplaces that have office settings, is the move to shared equipment and spaces. It was called like Workplace 2.0. It's been called hoteling, those sorts of things. But the concept is basically you don't have your own office, your own cubicle anymore. You sign in to a location, and you work from there. So as you can imagine, there's a number of concerns with that, especially if the workstation isn't fully ergonomically sound, it isn't fully ergonomically adjustable. If you're running into shared equipment, we've also got the concerns around communicable diseases, all those sorts of things, proper sanitation, all that. That is definitely a concern. So if you've got somebody with particular ergonomic needs, it might be they're spending a lot of time setting up the workstation to their needs and their body type in order to work efficiently and work safely. Along with that, we need to look at fire emergency preparedness. One of the things I always remind, or talk about when we talk about this concept is um, an, um, a fire drill isn't just a once a year thing that you do, check a box, and then you don't even look at it for a year. What should happen when we look at the fire preparedness plan is we want to remind workers about the specific procedures, um, about like the emergency evacuation plans. We want to conduct the drills, but we also want to evaluate, make in there any necessary improvements. So one of the things I always do in my own office, at the PSAC office in Winnipeg, is every year we have a fire drill. What we do afterwards is we have specialists that are at the building. They're evaluating people, making sure people are exiting safely. They're not carrying laptops. They're not carrying coffees. They're not talking on the phone as they're exiting. And we're learning from those sorts of behaviors to ensure they don't happen again. So we ensure that we're educating people on how to properly do that. If you've got people that aren't working in the office, full time every day, there might be an opportunity to learn from that. So even if they weren't there that the fire drill happened, there's the opportunity to learn from what we learned in the evaluation and make improvements. So really key aspect when you look at fire preparedness. Um, Alberta is not the best for health and safety. I've heard a number of concerns with workplaces that haven't had a fire drill in the past 2 or 3 years when they're required to be done annually. Need to get back in that habit. Um, Another issue that we always want to highlight when we look at health and safety, when we look at the role of the committee in evaluating, in making recommendations, that sort of stuff, is the concept of ventilation. Especially if we have workspaces that haven't been used for a long period of time. Chances are the boiler system, the heating ventilation system has been adjusted to close that area off. Number of concerns with ventilation when you reopen those. It could be things like mold, could be dust, could be things like Legionnaire's disease that we really want to evaluate, making sure that the ventilation and filtration system is working as it's intended, especially if we've got people going into that area or more people going into that area. One of the things also I think the employer kind of lost sight of is the interpersonal, well, I call it the interpersonal resolution stuff. So when people were working at home, they weren't working side by side with somebody. Um, there wasn't the same amount of interpersonal issues, gossiping, bullying, harassment, teasing, taunting, belittling happening in the workplace to the level that it was before the pandemic. What I anticipate seeing is those sorts of issues becoming more and more prevalent to deal with. Another issue that I don't think has been given the attention that it adequately deserves is the whole concept of sensitivity policies. If somebody had the ability to work from home, they didn't have to worry about if their coworker is wearing perfume or cologne or using a product that had scents in it because they weren't in proximity. When you get more and more people in close proximity to each other, we're going to see more and more difficulties with those people that have scent sensitivities and probably see more conflict as a result of that. Especially if you've got employers that don't adequately address the issues of scent sensitivities, ensuring the health and safety of each and every person in that workplace. Again, the employer has responsibility for each and every person in that workplace, including those that have scent sensitivities or allergies. Um, One of the things that's been lacking over the past number of years in a number of our workplaces is verifying that inspections are being done, making sure first aid kits are up to date, fully stocked, adequate numbers, those sorts of things. And the last sort of note that I've made is around making sure that updated health and safety information is posted in the workplace. So there's a requirement for a number of different pieces of information to be provided to each and every employee. Um, the wording is posted in a location accessible to all. Could be a bulletin board, could be um, a shared drive, those sorts of things. There's some flexibility in there. What we have to make sure is that that information is there and up to date, and we need to make sure that each and every employee reporting to that workplace knows where to find that information, knows where to find a copy of the Canada Labor Code or the respective provincial legislation, know where the health and safety committee minutes are being held, being posted, so that people can review and see what the committee is talking about, what they aren't talking about. Um, all sorts of information. Who's on the committee? The that has to be posted at a place accessible to all. That helps start the conversation about connecting the workplace issues with the health and safety committee. And what I've heard in a number of different workplaces is that a lot of that information isn't kept up to date. I was at a workplace a couple of weeks ago, walking around and asking some questions and chatting and stuff, and then we got around to the health safety board, and they had minutes that were 2 years old, uh, the list of the health and safety committee members that were not up to date at all, that sort of thing. So I'd like to see, this conversation be a trigger to ensure that all that information that is accessible to all and is post and is there available for everyone. When we look at this concept, we can't ignore the duty to accommodate. We've had all sorts of conversations. I do all sorts of webinars and different training around the duty to accommodate. Um, I'm really hesitant about going down the concept of duty to accommodate because it's one of those, Pandora's box type things where you open it up and it's like it opens up a can of worms and it's hard to kind of close that box. But I'll try to do that, concisely as briefly as I can. So when we look at the concept of duty to accommodate, um, that has to be considered separately from any other piece of legislation, any other policy, that sort of thing. Even in the return to office mandate policies I've seen, there's a proviso there for basically says except for those that require accommodation under the human rights legislation, that sort of thing. So it's clear even through there that the duty to accommodate is a separate process from the return to office policy mandate. Unfortunately, that's not what we're seeing in a lot of workplaces. What we're seeing in a lot of workplaces is blanket decisions where people are denied duty to accommodate, even though they've had long-standing accommodation needs for years and years, even before the pandemic. Um, Considerations where they were able to work from home, those sorts of things. Now these accommodations are being denied, even though they're well established and demonstrated to work well. They're being removed because of the strict application of the policies and procedures that the employers providing. So we definitely have a pushback on that sort of stuff. Um, and that's yeah, that's an issue that keeps me busy and keeps my phone ringing, and for good reason. And I'm happy to help work through some of those issues. So duty to accommodation can take many forms. It could be on family status, uh, daycare availability, school openings, if there's elder care, those sorts of things. We've seen lots of accommodation issues around those that have a medical condition, whether it's a physical or psychological injury that prevents them from reporting to the office and is better suited for them working remotely. Um, Removing, the difficulty somebody might have reporting and traveling to work out of the equation. And we also want to look at, make sure we consider those that are in a high risk category, those that are immunocompromised, those that, potential for exacerbation of their injuries, that sort of thing. We want to look at, make sure that those cases are being looked at. When we look at the concept of accommodation, There's a few key aspects that we need to consider. There needs to be flexibility. There has to be, some ingrained flexibility in the accommodation. So it's not a standard policy. Each and every person has to report to the office 4 or 5 days a week, sort of thing, whatever it is. There needs to be some flexibility built into that in order for those that need an accommodation for whatever reason. There has to be some openness. There has to be some conversation, uh, you know, for somebody that has an accommodation need to determine that they feel comfortable going and asking for an accommodation, outlining the nature of their injury or illness, or outlining the nature of their need in order to be heard and to be properly accommodated. And lastly, it has to be an individual consideration of needs. Obviously, when we look at a strict policy that has a blanket application for the employer without zero consideration of individual needs, that's where we're going to run into trouble like we see with the employer's mandates. The last kind of key consideration when we look at the concept of duty to accommodate is each of these cases has to be looked at on a case-by-case basis. You cannot deal with accommodation uh, on some sort of blanket policy that is applicable to thousands of people and expect it to work. Each person has different needs based on the nature of the need, based on the nature of the injury, based on the nature of illness, that creates some new factors. So you have to look at each of those cases individually, especially where you don't have that flexibility built into the workplace model. So when we look at the concept of health and safety and the return to office policies and the strict mandates, I think there's a number of different things to kind of summarize that we can really that key on looking at it specifically from a health safety perspective and kind of supporting some of the work that's being done at the bargaining tables, those sorts of things. Like I mentioned, those that require accommodation, absolutely, there's some clear legislation, clear language, some clear jurisprudence, precedent-setting stuff around the duty to accommodate the employer's obligations, what's required for an accommodation. For those that require accommodation, we've got some clear arguments to help those people out so that they're not considered under the strict application of the employer policies and their broad strokes to deny accommodation. As we've kind of highlighted and Marianne highlighted in her opening remarks, the health and safety language itself, the role of the policy and workplace committees and the health and safety representatives is really key. All sorts of really important, really valuable, and really relevant pieces of legislation in our federal language, in our provincial language that supports consultation, participation of the committees, of the representatives. Also, when we look at the issue, part of the role of the committees and the representatives is around reporting and recording. So if there's issues that are happening, the committees and the representatives have access to that information, see some of the negative impacts, and have the ability to make recommendations to the employer to make changes. There's a role for the committee in that process. It's not a top-down approach. If it might affect health and safety, the committee and the representative have to be involved in that discussion. That's clear in all of the language that we look at. And then lastly, one of the things, we've noticed, as we've gone through this process in a lot of our workplaces is what's enshrined in the policies and in the collective agreement language and the memorandums, that sort of stuff. There's some language in there that even the employer isn't following. So one of the examples is their duty to accommodate language. There's some wording that provides some flexibility when we see a lot of workplaces not providing flexibility, those sorts of things. That's when we'll inherently see challenges like grievances, complaints, those things, sorts of things coming forward to deal with those issues. Whereas if there was consultation at the beginning level, either with the unions, with the committees, with the representatives, a lot of issues that are now becoming prevalent could have been addressed even before the policy was put in place. So To kind of wrap up the conversation before I look to the Q&A section, um, there's lots of different steps and resources that we won't really build into to go into depth in this conversation. I think the key takeaway for me is if you're part of a local, if you're a member, if you sit as a health and safety committee, those sorts of things, there's all sorts of tools, resources, supports uh, in our union structure to help people out. So if, for example, a local is having difficulty dealing with an issue or working with the workplace committee or workplace representative on issue, there's all sorts of structures available. Sorry, just a second here. Sorry, I got a bit of a cold and I was running out of gas there. Um, so there's all sorts of supports available to people that need help. If it could be from the local, it could be the component. If you fall under the component structure, there's all sorts of really good supports, labor relations officers, um, component staff, component representatives, RVPs, all that sort of stuff can be really helpful managing and going through the system and its challenges. And as well, you've got your PSAC regional offices that you can refer to, if you need any help, if you need support, you need resources, those sorts of things. Important to note, and if you've attended these sessions with me before, you'll hear the spiel. So basically, respecting workplace, our union structure, myself and PSAC staff, we can certainly provide supports, opinion, resources, guidance, all of that sort of stuff. If anybody ever reaches out to me, I'm never going to say no. But respecting our union structure, when it comes to workplace resolution and how things in the workplace are resolved, we have to defer to the local, we have to defer to the component, and we have to defer to those workplace committees and representatives to determine what the workplace resolution will be. So we can work through all that sort of stuff, but we can, but the key takeaway is there's all sorts of resources available to those that need it. One of the best pieces of information when we look at things like we've talked about around like fire preparedness, safe occupancy rates, ventilation, all those kind of concerns. If you need help and information on all those different aspects of health and safety, the best source of information I can provide, because that's a one-stop shop, it's made up of PSAC members. They provide both federally regulated and provincially regulated guidance, is the Canadian Centre for Occupational Health and Safety. And there's their website there um, to find out all sorts of information. So if you want more clarification on ventilation and the concerns and challenges and issues, potential hazards around ventilation, that's a really good source to get some guidance, get some direction. And I use it all the time to find information. So really important. The last one, especially for our federally regulated members, is super important, and I'll go into a little bit why. So if you have an employer that's not engaging the committee, not engaging the representative, not consulting, not having the committee participate, not following the guidance under the Canada Labor Code, the regulations, they're not addressing hazards related to health and safety, and the committee's not able to resolve those, here is the number that you would call 1-800-641-4049. That's the number to get to the health and safety officers at ESDC. And they will be able to provide some guidance, provide some direction. They're really the hammer when it comes to enforcing employer responsibilities. Committees, representatives can ask questions, they can raise concerns, they can make recommendations, all that sort of stuff. When that fails, where do we go for support? We would go to our health and safety officers, in our provincially legislated workplaces, or ESDC for guidance. If you contacted that number, explain the situation, one of the things they're going to ask is, have you consulted the committee? Have you consulted the employer? What has been the resolution? Where's the issue still? If you haven't gone through the committee, they'll likely send it back to the committee for consideration before they receive it. They can also provide some guidance and point you to the right sections of the Canada Labor Code, even if they aren't in a position to investigate and provide direction or orders. They're a really good source for holding the employer accountable, especially when we have um, workplaces and committees and representatives that aren't functioning to their full capacity as outlined in the Canada Labor Code. Um, Marianne's mentioned it to me as well that, you know, people call her with a health safety concern is, yeah, you've had this problem, you have this problem. Did you call ESDC or contact somebody from ESDC? If the answer is no, that's where we're going to go to hold the employer accountable. They're the body that has the ability to enforce, to direct the employer. And lastly, there's always myself. There's my email there. Um, Anytime you have a question, absolutely, I'll do my best to, provide resources, provide opinion, provide supports wherever I can. Um, what I will do, tomorrow or later this week is for all the attendees, I will send you a copy of this slide presentation. And I'll also send you a fabulous resource around enforcing health and safety measures, the steps to take. So to go through the internal complaint resolution process, talking to the employer, talking to the committee, involving health and safety officer, outline those steps, outline some of the concerns that we have, uh, outline some of the language in our Canada Labor Code and provincial corresponding legislation that supports the committee's role in this sort of discussion. And it'll be a really good takeaway to continue that conversation back in your workplace, have the conversation, that sort of thing. Um, One of the things I'll try to do is send a copy of this recording so that you have the opportunity to share this as well. Um, Not directing Brianne or Marianne, but I'm sure that there's the opportunity to post the recording of this and the resources that I'll provide on the website so that everybody has access to it. So yeah, we're right about on time where I thought I'd be for our discussion. What I would like to do is, because we're recording, what I will do is kind of go through the Q&A section a little bit, answer some questions that people might have, share some concerns, that sort of stuff, to address, some of the particular concerns, clarification, that sort of stuff. So, in a second here. Okay. So one question in our Q&A is, if a member has to take time to sanitize and set up a workstation for ergonomics, is this done on work time or personal time? That's work time. That's part of the work that's required, right? I used to work a job that required you to report to work 15 minutes early before you got paid to do some of that sort of stuff. And it's like a heck no now. I'm a lot more knowledgeable on health and safety issues, that sort of thing. That's a no-go for me. If that's part of the work, then that's on work time. And the employer needs to take that into consideration, especially when you've got shared spaces, that sort of thing. Next question. Is there any clear guidance on whether the employer has to supply us with N95 masks if we request them and not use the expired masks? Yeah. And have access to gloves that have an expiry date on them. Yeah. So yeah, we've seen a lot of workplaces that are trying to use up um, masks and gloves, things like that, that are in surplus, and a lot of them have expiry dates, that sort of stuff. There is some guidance on that. Absolutely, there's expiry dates on those and expiry dates on them for a reason. Those should be adhered to. When we look at the concept of whether N95 masks or gloves are required, that's a bit of a different issue that depends a lot on the workplace, the work being done, those sorts of things. So before I worked for PSIC, I was a local president. One of the things I did, I worked in central sterilization in a hospital, which was actually not a bad job when you consider it. Um, but it gives me a different perspective when we look at things like communicable diseases, that sort of stuff. Um, Not a big fan of wearing gloves in the workplace. One of the reasons for that is because people wash their hands less, and wearing gloves, if they wear them all day, if there's an exposure, that's going from glove to location, location throughout the day without any sterilization in between, or breaking that cycle by washing hands, that sort of stuff. That's kind of my general response to that. Uh, but it really depends on the workplace, the work being done, that sort of thing when we talk about that. But that, what should happen is the committee should be involved in those discussions in determining what personal protective equipment is being provided, what's necessary, those sorts of things. So that's a really good example of one area where the committee ought to be consulted, ought to participate in the determination of what personal protective equipment is required in depend on the positions that are being done in that workplace. Okay, next question. Can you please expand about the employer's responsibility with respect to issues of safety downtown? Our office has been advised the employer is not responsible, um, not responsible for anything outside of the workplace. Yeah, that's a typical response from the employer. My opinion is different on that. Like I kind of explained, um, when the employer decided where to put their office buildings, if they decided to put it in the downtown location, they ought to have considered the potential foreseeable hazards with working in a downtown location and the hazards that are posed by that. Um, it might be more convenient for travel and might be more convenient for access from for the public, that sort of stuff. But it does not absolve the employer of their responsibility to consider that and use that as part of their decision-making process. Um, and like I said, there's been lots of debate with employers saying it's not their responsibility when absolutely it is to the impacts of health and safety on workplaces. They don't get to wash their hands of it because it's outside of their control. The office being there was in their control, and they decided to ignore the potential hazards. And as kind of I mentioned a little bit, what we're even seeing in a lot of our downtown locations uh, is more severe and more frequent hazards associated with health and safety in downtown settings. The employer ought to consider that, making changes to their policies, procedures, direction, that sort of thing. Could be things, as simple as a buddy system. Could be limiting the range of hours that work. We typically see increased risk if people are working earlier in the morning or later in the day when it starts getting dark, those sorts of things, leaving the office or reporting to the office at those times. If that can be avoided, then that's something definitely the employer should consider. Management in our office has advised that they are not responsible for managing scent issues in washrooms used by multiple federal agencies. Smell of cigarette smoke, perfume, that sort of stuff. Absolutely not. Yeah, the and that's one reason why I highlighted in the slides the scent sensitivity policy and an issue that that comes up in a lot of our workplaces. The employer, because that's a difficult issue uh, to resolve, especially when you're dealing with the public and clients, that sort of stuff, is oftentimes the employer doesn't take adequate steps to protect those that have scent sensitivities. Absolutely, it's the employer's responsibility. Um, if employees affected need help with that, they should go to their local, they should go to their workplace committee and discuss what steps they can do to protect their health and safety. Um, it creates some issues. As I mentioned in the outset, the employer has a responsibility for each and every employee. And there's no, except for those that have sensitivities, we don't have to do anything to protect their health and safety. That's not how it works. So next question, you said from offsite parking to building as part of the workspace. Would that include bus stops on the way to and from the building? The kind of example I use to kind of clarify this is what would workers' compensation decide? So when we look at when we define workplace and workspace, um, what would WCB look at? WCB will look at safe entry and egress. They'll look at different work locations if you're doing site visits. That you know the transport from point A to point B location, that sort of stuff. What they aren't normally responsible is for the bus stops, where that's clearly part of the public. Um, that does not absolve the employer of their responsibility to take that into consideration and take precautions in place that they do control. So again, might be things like the buddy system, might be adjusting their hours to times that are safer to be, at a downtown bus stop, that sort of stuff. All of those need to be considerations when we look at this issue to see what can be done to minimize the risks and the hazards. Is the employer responsible to provide staff parking? Not necessarily. Depends on the workplace, the work being done, that sort of thing. Is a vehicle required for the job? Is there fleet vehicles available? That sort of thing. Depends on the work and the workplace and the work being done. But generally, the employer is not responsible. They would be responsible if they dictate that you must park here. You're required to have your vehicle. You're required to use the fleet vehicle, and you have to park it here. That would be considered the workplace, in my opinion. And because the employer has directed that to be part of your work, then that needs to be part of the consideration for the employer's responsibility to minimize and reduce and eliminate every potential and foreseeable hazard. So next question, I've been trying to get the employer to provide disposable seat covers, but I'm having no luck. With everybody coming back to work full time, should this not be an essential health and safety equipment? Could very well be. What I would suggest is that would be the role of the committee to make that determination. So the committee or the health safety representatives should be having consultations, should be having discussions, should be participating in the implementation. If the committee feels that that is a step that the employer should take around health and safety, then the committee can provide a recommendation to the employer. The employer has 30 days to resolve, and then if there's no action taken or not sufficient action taken, then we can take it to the health safety officers to provide direction and clarity on that. Is it required to have a list of first aid trained people in a unit building? I work in an RCMP headquarters where all regular members are trained, but there isn't always an RM in the unit. Uh, yes, there is a list of trained people required for each building. So depending on the size of the workplace and the number of employees in that workplace, especially in the smaller, the rural municipalities, there should be somebody still trained on first aider to provide first aid needs if needed. My employer is no longer providing cleaning supplies such as sanitizing wipes to sanitize hoteling workstations or dish soap for the kitchen. Is there anything we can do? Another good question for the committee to address, resolve, have discussions on that sort of thing, and make a recommendation to the employer. That's all no-brainer stuff, in my opinion, especially when we look at work locations that are hoteling. Why you would deny sanitizing wipes when you're in shared spaces? Like, have we learned nothing from the pandemic? Again, from my background in infectious control sort of thing, that just drives me nuts. The level that the employers not following through with their clear obligations to provide a health and safety workplace. The employer takes the view that you're not responsible until you enter the building. Should you be calling ESDC? Absolutely should be a conversation that you're having with the committee, and then you should be calling ESDC if that's not resolved. The issue that ESDC or the health and safety officer is going to work through is that whole concept of, to the extent the employer controls the activity, that's really going to have some particulars around the work location, that sort of stuff, that'll have to be worked through. But the conversation should still be happening at the committee level. Nobody understands the workplace better than the people in the workplace doing the work. Nobody's in a better position to identify hazards better than the people in the workplace doing that work. And nobody's in a better position to address any concerns better than the people in the workplace doing that work and managing that work. Uh, okay. The last
Clint,
question
can
I
I just
yeah,
can I just add something to that?
absolutely. Yeah, I did see your hand, but I was going to get to the last question.
No,
But knock yourself. Go ahead.
no, it's
No.
okay. I just want to say, like, whenever, we're saying take it to the committee, there's a good chance, as like all my years on health and safety, they just say no, no, no,
Yeah.
no, no. You need it documented in the minutes that you asked.
Yeah.
And you need to make sure that when the minutes come back, that they accurately reflect that you asked why they are not providing sanitizing wipes for hoteling stations. And the employer said no, or the employer said they'll get back to you, and you raise it at the next meeting. That's information that ESDC needs, or if you're in a component and in a national department, then those minutes need to be sent up to your national committee to show that you've tried to resolve this and they're refusing. If they're stalling, but that's why, are you going to get resolution? 90% no, but you need it documented.
Yeah, no, and that's always the question that we face, right, Marianne? Is okay, I'm hitting the stone wall I brought at the committee. The employer's done nothing, they've ignored, they've brushed it off, that sort of stuff. Where do we go? We then go to the legislator, the health safety officers that have the power to provide direction or order to the employer, and we also use the tools in our toolbox through our component structure, through the national policy and regional policy committees, to help deal with issue on a more consistent basis. Because what we tend to see, especially when we talk about things like downtown safety, those sorts of things, it's not limited to one workplace, right? And it might be really difficult for one workplace to solve that issue when it's a national issue, when it requires national top-down direction from the policy committee, those sorts of things. So absolutely really valuable to have, you know, have those discussions and have a good understanding of where to go when you hit that eventual and foreseeable roadblock where the employer doesn't want to do anything, doesn't want to properly address. Where do we go? Go to your policy committee, go to your component, go to ESDC, those sorts of things, all sorts of tools in the toolbox. And as I kind of mentioned, ESDC, you know, even if they aren't in a position to provide direction or order, they can certainly provide direction on the steps you need to take in order to properly address. If you've documented and clearly enshrined in the minutes that the committee's attempted to deal with this, then it makes it much easier for the health safety officers to get involved. The last question is around some guidance on dealing with the issue of downtown safety. What I will do is provide some resources and tools that I'll use as guidance on how to address downtown safety issues that you can take back to discuss with your workplace. One of the key ones that I've always found really valuable, and I'll provide direction on, is something that we do in our offices, even in Winnipeg with the PSAC, and that's the Winnipeg Police Service. And I know Regina, Saskatoon. I've talked to Edmonton. I don't know about Calgary area. Uh, and then even in our remote locations, the RCMP will come out. They'll come out and do a half-hour presentation for workplaces on downtown safety, how to deal with the unhoused, how to deal with those that are dealing with mental health issues, substance abuse issues, those sorts of things, how to report to work safely. The police services will provide free training on a lot of those aspects. That's really valuable, that sort of thing. That, when we look at the concept of downtown safety and we're having trouble dealing with that, it might be the committee making a recommendation that part of the training that each and every employee gets is attending something from the civic police services or the RCMP, that sort of thing, on how to report to work safely. So I'll provide some links and resources to that in my follow-up email, and as well as some guidance on that. and leave you with some tools, to deal with that issue. And that's one reason why we're having the conversation this evening is there's been a lot of issues, with downtown safety, that sort of thing, that are absolutely relevant to our discussion. And yeah, clearly heard that there's the need and the desire for how to handle those conversations in the workplace with the employer, at the committee level, at the policy level, that sort of thing. So with that, like I said, I'll send a bunch of resources in a follow-up email to everyone. I'll send the link to or I'll send the slides. We'll have a link to the recording of this presentation available to all, so that we can share and reflect back on this conversation. Uh, but I do want to thank you for giving up the time this evening to hear Marianne and myself talk about this issue. Obviously, I feel like we've just scratched the surface on a lot of this conversation, but hopefully it's opened up the dialogue, got some people thinking about all the different potential hazards and challenges with reporting to the office. Um, and you have a better understanding of the structure, so that if you do need assistance, you have a better understanding of all the resources and tools and procedures available to assist you. So with that, I will look to Marianne for some final thoughts before we bid adieu.
Perfect. Thank you, Clint. Um, all good ideas. And we don't know how many of you on the webinar are health and safety committee members, or are a representative in the workplace. But the first thing you need to do is find out, if you are not, find out who is, right? And, Clint will send out, and yes, we will get it posted. That's not a problem. We can do that. Share the link with them and what you've learned. Talk to coworkers about it. Because in a lot of situations, everyone knows there's a problem, but if we're not following through on the process and kind of standing together on some of this stuff, especially, some of the downtown safety issues, like folks need to be prepared to say, this is not safe. I'm leaving. And that is scary as hell. We're not telling you to do that. But ultimately, if the employer is endangering you, um, you have to protect yourself. And having those conversations in the workplace with other people who may be thinking the same thing that you're thinking, and making sure that not just that you're telling your committee, go do this for me, but that you support them when they go to the table, right? That collectively as a workplace, everyone is, these are the things that we need, that we believe, meet the requirements that the employer should be providing for a safe workplace. So, work with your committee, work with your representative. And if you don't know who it is, then, go to your local, go to your component. And you know what? Maybe you don't have one. And that's because nobody stepped up, right? Someone has to do that too. So, there's a lot of mechanisms. And, if you run into a roadblock, don't give up. Just find another path forward. And maybe that's calling Clint saying, you know, they told us this, that, or the other thing. Where do we go from here? What would you suggest? Because ultimately, at the end of the day, if, as folks are returning to the office, you're spending a lot of time there and they have requirements of what they have to do. So, we sometimes take for granted all of the rights that we have under our health and safety legislation that a lot of workers don't have. And so I really encourage all members to take advantage and utilize all of the tools in your toolbox, that Clint has put in your toolbox. And, basically advocate for yourself. But you have to go through the committee or the rep. And, we can, as things develop, we've done a lot of these webinars. So, I want to thank Clint who, when I walk down the hallway and say, hey, Clint, how about a webinar? Initial reaction is absolutely, there's a lot of questions out there. So, Thanks, Clint, for putting this together. Thanks to all of you for taking time tonight. And I'll say that the recording, give it about a week just to make sure we can download it and get it all up. And Clint can send you the link when he sends out a follow up. So thanks everyone for spending some time with us tonight.